Today I want to talk about two new studies that are especially pertinent to anyone who's interested in health and also bodybuilding gains. I'm going to read actually I'm going to read a press release. The first study. Well, let me backtrack. The first study has to do with a popular B complex vitamin called niacin. Anyone who's interested in nutrition, who knows even the slightest modicum about nutrition, knows that niacin has been used for years to treat elevated blood lipids, particularly elevated low-density lipoprotein, which some physicians think is the heart of cardiovascular disease. Low-density lipoprotein is the main cholesterol carrier in the blood, and it's associated with atherosclerosis. What they fail to often tell you about LDL, though, is that it's only kind of sticky. It only kind of sticks to your the lining of your blood vessels or the endothelium when it's oxidized. Normal LDL is not that dangerous, but they always leave that part out. Every video, every doctor I've seen interviewed, all they talk about is how bad LDL. They never differentiate. In the last couple of years, they've shown that a lot of the differences in LDL, meaning how dangerous it could be, is also related to the size of the LDL particles. They found that what they call large, fluffy LDL, I'm not sure whether that's type A or type B LDL, I don't remember, but the larger, fluffier form of LDL is less subject to oxidation. Therefore, it's less associated with atherosclerosis and cardiovascular disease. The other type of LDL is small, dense LDL, which is highly subject to oxidation. Now, the ironic part about this is that the heart associations always recommend that you eat a low fat, high carbohydrate diet to help you prevent cardiovascular disease. The interesting thing about that is a low fat diet is a huge potential cause of it creates greater amounts of the small dense LDL that's more subject to oxidation. So this idea that a low fat diet is more amenable to preventing cardiovascular disease is really nonsensical. It doesn't make any sense from a biochemical point of view. But in this video, I wanted to talk about it's related to LDL, but it has to do with a new study. I believe the journal that it was published in was called Nature Medicine. It's a pretty respected journal. They came out with a study indicating that niacin, and again, niacin goes back maybe 50 years, more than that. It's been suggested as a way to help prevent cardiovascular disease because, like I say, it seems to lower LDL, and more importantly, unlike statin drugs, which will possibly lower LDL, statin drugs do not raise protective high-density lipoprotein cholesterol, or HDL, whereas niacin does. Niacin also has an advantage over standard drugs to treat, let's say, cardiovascular disease or atherosclerosis, because niacin also it helps to lower triglycerides, which is another risk factor. And it's one of the only nutritional substances known that could possibly lower another risk factor for cardiovascular disease called lipoprotein small a. Lipoprotein small a is related to LDL. People that have elevated levels of lipoprotein small a have approximately 3 to 5 times greater chance of having a heart attack or a stroke. A lot of your lipoprotein A levels are determined by genetics, but most drugs that are prescribed by doctors to lower, let's say, cholesterol, like statins, they don't affect lipoprotein small a alone, but niacin does. It actually will help lower lipoprotein A levels, and in that sense offer protective effects against cardiovascular disease. So for these reasons, niacin has been sort of a mainstay for years in treating cardiovascular, because of the notion that it's a natural supplement, it's a vitamin, it's not a drug. Now the dosage of niacin, by the way, I should also point out, the protective effects against cardiovascular disease only exist with niacin. Doesn't exist with niacinamide, which is another form, and it doesn't exist with flush-free niacin. Those forms of niacin do not affect blood lipid levels. They're not going to help at all. However, like I say, niacin in doses starting at 500 milligrams all the way up to 2,000 milligrams a day have often been suggested over the years as a preventive substance to help treat or prevent cardiovascular disease. However, in more recent years, when they've compared or looked at the effects of high-dose niacin, they've noticed that niacin doesn't seem to have as great effect as expected in preventing cardiovascular disease, and also, in some cases, it seems to accelerate cardiovascular disease, but nobody could figure out why. Now, one of the bad things about high-dose niacin, and anyone who's taken niacin knows this, the most common side effect is a flushing effect. In other words, what happens is when you take, let's say, 500 milligrams or more of niacin, especially if you haven't taken that high a dosage, you'll get this like flush feeling in the skin. Your skin turns red, and you can get an itchiness in the skin. With that's actually, although it's uncomfortable, it's a harmless effect. It's caused by the dilations of subcutaneous blood vessels induced by niacin. As a matter of fact, years ago, bodybuilders would often pop a couple of niacin tablets before going on stage to pose, in the belief that niacin would bring out the vascularity of the veins. Unfortunately, it doesn't do that. The veins that niacin helps to dilate are subcutaneous, a little below the skin, and they wouldn't really affect the more superficial veins or on the top that would induce a greater appearance of vascularity. Same with red wine. Red wine, they still drink red wine thinking it's going to bring out the... That's also nonsense. That's another myth. But I don't want to get too much off the topic like I always do. Back to the study. Anyway, these doctors, they looked at, they tried to figure out reasons why niacin not only is effective as it should be. I mean, when you consider all these beneficial effects that I just mentioned about niacin should be a no-brainer for using to help prevent cardiovascular disease onset, and yet it's not as effective as it's supposed to be. So a couple of doctors from the Cleveland Clinic looked into it. Now, this is an important point. I know there's going to be a lot of videos about this study because niacin is so popular, but all these videos I guarantee are not going to mention what I'm about to tell you now. The lead author of this study from the Cleveland Clinic that looked into the potential dangers of niacin in relation to cardiovascular disease, the lead author was a guy named Stanley Hazen. Now, Stanley Hazen, a couple of years ago, came out with another study where he basically implicated the nutrients carnitine and choline as causes of cardiovascular disease and atherosclerosis. Now, in that situation, the reason why choline and carnitine could possibly cause atherosclerosis and other diseases is because it's converted by intestinal bacteria into a substance called TMAO. And its TMAO was the dangerous substance that caused a proliferation or an increase in atherosclerosis and kidney disease and even brain disease. That's what he said. So in that study, he advised, this Stanley Hazen from Cleveland Clinic, advised people to completely avoid ingesting choline and carnitine as a protective mechanism, because he said that choline and carnitine are not really essential to consume in food anyway. Now, it's true, choline and carnitine are both made in the body. However, this is an example of why doctors are often not as well versed in nutrition as they should be. In recent years, biochemistry researchers have noted that choline is much more important than was previously considered, and the body, in many cases, does not manufacture enough choline from amino acids as needed. Under certain, it's like a conditionally essential nutrient. So they recommend at least 400 milligrams a day of choline. Choline is very important for helping to prevent fatty accumulation in the liver, known as fatty liver or non-alcoholic fatty liver, which is in epidemic proportions throughout the world. And also, choline is the precursor for acetylcholine, which is a very important neurotransmitter in the brain, especially in the areas having to do with memory and intelligence. One of the problems that people with Alzheimer's disease get is the neurons that produce acetylcholine in the brain are selectively destroyed, and that's what leads to the memory impairment problems that are associated with dementia and Alzheimer's disease. So choline is, contrary to what this doctor said, is very important. And as far as carnitine, yes, carnitine is manufactured in the body, but it's essential for the transport of short-chain fatty acids. Transport of fatty acids into the mitochondria, where the fatty acids are oxidized in a process called beta oxidation. So carnitine is without question an essential nutrient. And again, in many cases, the body does not. Carnitine is also made from amino acids with the assistance of a couple of other nutrients, such as, ironically, niacin is involved in the production of carnitine in the body. But carnitine is, again, absolutely essential for fat oxidation. And the other thing to consider is that, again, dozens of other studies show that carnitine, if anything, is preventive against cardiovascular disease. It's very, very, very useful for heart function because the heart actually prefers to burn fatty acids rather than glucose as a primary source of energy, and it needs carnitine to do that. So, to suggest that people not consume choline and carnitine, and also he said that the reason why people get or have a greater risk for cardiovascular disease from eating meat is not from the saturated fat in the meat, but rather from the natural carnitine content of the meat, which is complete and utter nonsense. Now, TMAO still remains a controversial subject or topic in biology and medicine. However, as I pointed out in my applied metabolics, and I'm also going to do an update on the TMO controversy, there's other studies showing that TMO is not quite as dangerous as this doctor prevented. Not only that, but there's a number of natural nutritional substances that can actually completely suppress the production of TMO by the intestinal bacteria, therefore make it harmless, especially if you consume choline and carnitine. Among these nutrients, I'm not going to go into all of them. There's one called pterostilbene, which is very similar to resveratrol, and it completely short-circuits the production of TMO by intestinal bacteria, as does garlic. So, there's ways around that where you could still have your choline and carnitine and not worry about TMO. Now we get to the present where the same researcher, Stanley Hazen, comes out with a study implicating, he didn't, actually, let me read you. It's the best thing for me to do. Let me see where it is. I want to read you a press release about this study, so I'll comment on it as I read it. And it goes like this. Niacin, a vitamin B3, has long been a U.S. public health darling to the point that it is added by law to cereal products. By the way, a deficiency of niacin is called pellagra. It was one of the first nutritional deficiencies ever discovered at the turn of the 20th century. But a new study published Monday in Nature Medicine points to a potentially concerning effect of an excess of the vitamin. It may increase the risk of cardiovascular disease. The study looked into two cohorts of patients with active heart disease, 60% of whom were treated with statins. That's the most common drug for treating elevated blood lipids, and found a strong association between a metabolic product of excess niacin. In other words, the niacin that's often suggested to treat or prevent cardiovascular disease, which is 500 milligrams to 2,000 milligrams, and an increased risk of major adverse cardiovascular events such as a heart attack or stroke. 1 in 4 of the people in the study had excess niacin, which doubled their risk of major cardiovascular events to levels comparable to those with diabetes or a previous heart attack. It's a fairly sizable risk. It's on par with what we consider other risks, said Stanley Hazen, the section head of preventive cardiology and cardiac rehab at Cleveland Clinic and this senior author of the study. This opens up the door. It lays the foundation for new studies and new interventions for blah, blah, blah. Niacin's ability to increase high-density lipoprotein cholesterol, as I mentioned earlier, often referred to as good cholesterol, and lower low-density lipoprotein cholesterol, LDL, the bad type, made it a first line of intervention to prevent cardiovascular disease prior to the introduction of statins. But the new findings suggest that excess niacin, which is also thought to support nervous and digestive system health, may have mixed effects on the body, although outside experts caution it's too early to say for certain. This is the same situation as occurred with TMO. This guy's jumping right to the conclusion. This guy, Hazen, is jumping right to the conclusion that niacin is going to kill everybody. If they take high-dose niacin, they're all going to have heart attacks or strokes. There's been no follow-up studies, but to continue. This is what another cardiologist commented on the study. To draw an inference that niacin increased cardiovascular risk in those trials is not necessarily accurate, says Sanjay Kaul, a cardiologist at Cedars-Sinai Medical Center who did not participate in the study. Coronary heart disease and related mortality were not significantly increased, so I have difficulty in connecting the dots. In other words, this guy is the guy is Hazen. He's offering a hypothesis that it's going to cause increased coronary heart disease and death, but it didn't occur. In other words, he's pointing out the reason why it could, but there's no cases where it did, basically. In other words, he's jumping the gut. Now, what was the cause? Why would niacin do that? Niacin, in large doses, certain metabolites are produced from niacin, particularly one called N1-methyl-4-pyridone 3-carboxamide, or 4-PY. Now, what Hazen says in the study is that 4-PY increases cardiovascular risk through an inflammatory reaction. And he says that this identifies a previously unknown pathway that can cause adverse cardiovascular disease. Basically, let me see what else I'm just going through. I don't want to read the whole thing. The results were consistent with findings in 2 large niacin studies, which found that when people already had low levels of bad cholesterol, putting them on niacin led to worse cardiovascular outcomes, even though the compound is known to increase levels of good cholesterol. So let me see what else. I don't want to, again, read the whole thing here. William Bowden, a professor of medicine from Boston University School of Medicine, who did not participate in the study, was hesitant to conclude niacin equals cardiovascular risks. He says, while it's true that in the current statin era, we do not have compelling evidence that niacin treatment reduces cardiovascular death or stroke, I am wary to conclude that there is a definite evidence of harm associated with niacin based on this study. So there's 2 other cardiologists. And then another one comments, the study does not address the situation of patients taking prescription niacin, which is delivered in concentrations 20 times higher than in supplements, said Daniel Rader, a professor of medicine and genetics at the University of Pennsylvania, who was also not involved in the study. What are the levels of 2-PY, this is the substances, 2-PY and 4-PY in people who are taking pharmacological doses of niacin? The expectation would be that they would be astronomically higher because the amount of intake of niacin is in orders of magnitude higher. So if 4-PY really is pro-inflammatory and increases risk, as they suggest, I guess I just would expect that pharmacologic doses of niacin would clearly be bad for you. However, numerous previous clinical studies of pharmacologic niacin have only failed to confirm its benefits and not found any significant risk associated with it. So that's the study. Now, I'm done reading the press release, but I want to add, why would this niacin metabolite called, well, there's 2 of them, 2-PY and 4-PY. But why would, let's say, 4-PY, again, it's a metabolite of large doses of niacin. Why would it increase atherosclerosis or heart disease? Because what it does, it increases another substance called VCAM1. Now, VCAM1 is noted, many studies have shown that VCAM1 does indeed cause an inflammation of the blood vessels that's associated with atherosclerosis and cardiovascular diseases. So again, the mechanism is that excess niacin will produce a metabolite called 2 of them, 2-PY and 4-PY, which will promote the release of VCAM1, VCAM1 increases inflammation within the blood vessels and stimulates cardiovascular disease. Now, here's something, again, that's probably not mentioned in any other videos, certainly not mentioned in this study, but VCAM1 is controllable, just like TMO is controllable by natural substances, so is VCAM1. For example, the nutrient resveratrol obliterates VCAM1, so does various flavanol substances that are found in fruits and vegetables. Soy contains isoflavones that neutralize VCAM1. Vitamin C is very effective at eliminating VCAM1. As a matter of fact, Linus Pauling, who won the Nobel Prize twice and is considered one of the fathers of biochemistry, organic chemistry, he stated almost 50 years ago that vitamin C protects against inflammation in the blood vessels. Probiotic supplements that contain live bacteria also neutralize VCAM1. Vitamin D neutralizes VCAM1. So here's what's the point? The point is, even if this study is true, that larger doses of niacin produce metabolites that could be deleterious to blood vessel inflammation through the VCAM1 mechanism, there's other nutrients you could take where it basically eliminates the problem. As one of these cardiologists pointed out, that there's no evidence that the niacin caused increased mortality or even stimulated heart attacks and stroke. It's strictly a theory on the part of this guy Stanley Hazen. He raised the same alarm bells with TMO, and most of the things about TMO are just bullshit. Taking in carnitine and choline is not going to give you a heart attack. If anything, they help prevent cardiovascular disease. This is another example where you got to be careful of listening. It's called appeal to authority. It's considered a logical a mistaken logic to listen to a person simply because he has an advanced degree, or even a cardiologist, to take everything he says as absolute fact. You've got to be really careful about that. Now, the second study I want to talk about, again, I have a press release to make it easy to talk about. This one directly affects bodybuilders, and this is really alarming when you first look at it. It has to do with leucine. This study basically said that if you consume, get this, you won't believe this, if you consume more than 25 grams of protein per meal, the amount of leucine you're getting will cause, again, just like niacin, will cause a inflammation of the blood vessels and stimulate atherosclerosis and cardiovascular disease. Now, what's the mechanism here? The mechanism is that leucine, which is one of 3 branched chain amino acids, leucine happens to be the most potent amino acid at stimulating a substance called the mammalian target of rapamycin, or mTOR. mTOR basically directs amino acids into a protein synthesis pathway that results in increased muscle growth. This is the reason why you ingest protein if you want to get bigger muscles. Exercise stimulates mTOR. Anabolic steroids, all these things stimulate mTOR. It's a growth substance. Leucine happens to be the most potent amino acid at stimulating mTOR. Now, what they say here is that the problem is that mTOR, among its functions, it tends to inhibit a process called autophagy, which is basically the way the body gets rid of old cells or abnormal cells. It's very important to health. Now mTOR, in this particular study, they noticed that leucine increases mTOR. The increase in mTOR inhibits the autophagy of blood cells called monocytes, which are involved in the atherosclerosis process. So based on this, the study concluded that eating more than 25 grams of protein, I just want to read here and see if this, they're basically saying According to Rose, any ensuing recommendations about limiting protein, blah, 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 anyway, the point is that they're saying that they're kind of suggesting that you avoid consuming large amounts of leucine. However, 25 grams of protein is not a large amount of protein. That's the exact amount of protein that's been recommended for years as the maximum dose of protein to stimulate muscle protein synthesis, although a recent study showed you can ingest as much as 100 grams of protein and for the same purpose of increasing muscle protein synthesis. Now, again, this is to me, in my mind, anyone who knows about nutrition, this is a pretty nonsensical study because, first of all, you can easily control, just like you can control TMO by ingesting certain nutrients that'll neutralize TMO. The same holds for mTOR. You want to stimulate mTOR if you're interested in any kind of muscle growth. If you block mTOR, there's no muscle gains at all. So you don't want to do that if you're involved in bodybuilding. Obviously, you don't want to cut out leucine out of your diet. You don't want to do that. It's an essential amino acid. It's needed in human nutrition. So what you do is you control mTOR. How do you control mTOR? You control mTOR by stimulating, and I mentioned this in a previous video, you control mTOR by stimulating another protein called AMPK. There's a number of ways, which I mentioned in a previous video. For example, ingesting carbohydrates, there's a drug metformin, ingesting the supplement berberine. All of these things increase AMPK. Aerobic exercise increases AMPK. AMPK will block or neutralize most of the effects of mTOR. Unfortunately, that includes protein synthesis, but it'll also offer a protective effect against some of the negative effects of mTOR, such as this stimulation, prevention of the autophagy of monocytes that could possibly cause cardiovascular disease. So what's the point of this discussion of these two new studies? I think they're being taken out of context, where it's causing unnecessary alarm in many people who think that niacin is now going to, rather than prevent cardiovascular disease, will cause cardiovascular disease, which it doesn't. Also, they will probably scare the hell out of a lot of bodybuilders and athletes who now think that eating protein is going to cause them to have heart attacks and strokes. Utter nonsense. It's not going to happen. And I'll give you a simple piece of evidence to prove that. If leucine was that potent at causing atherosclerosis through the mTOR mechanism, that means that every person who's taking in large amounts of protein, like animal protein, let's talk about 250, 300 grams of protein a day, they should all be dead from heart disease. If this study was accurate, all of these people should be dead from heart disease. So why aren't they? The reason they aren't is because they're ingesting other foods that contain nutrients that possibly increase AMPK, like I said, or let's say they're exercising, they're doing aerobics, they're modifying the effects of mTOR so they're not dropping dead. So don't worry about this stuff. These are preliminary studies. I think they cause unnecessary alarm for people. Based on the result of I don't use high dose niacin. I tried it a couple of years ago. I really didn't really care for the flush effect. I control my blood lipid levels through other supplements and means. But if for some reason you want to take high dose niacin, I don't think there'd be any problem as long as you follow the guidelines I mentioned earlier. I should also point out that some of the products, other popular supplements that are people are using for, let's say, longevity purposes, such as NMN and NR. These are niacin products where theoretically they could cause the same problem as taking large doses of niacin. But again, they've done a lot of animal and preliminary human studies on NMN and NR, and if anything, they've shown great benefits for heart health. None of them have shown, these dozens of animal studies, there's been no increase in cardiovascular disease whatsoever from taking these niacin derivatives. So I'll leave it at that. If you want more information on nutrition, exercise science, anti-aging research, ergogenic aids, hormonal therapy such as testosterone replacement therapy and growth hormone therapy, women's health and fitness, supplement science, which supplements work, which ones don't. Again, I've said this, I'll say it again, I'm not associated with any supplement company, and that's a big issue with these YouTube videos, because 9 out of 10 YouTube videos that are related to nutrition are people that are associated with supplement companies. In other words, they're on the payrolls of supplement companies to push certain types of food supplements. You'll notice in my videos I never mention brand names when I talk about supplements, and I do the same in my Applied Metabolics. I don't discuss brand names because I'm not a shill for supplement companies, and I'm not going to say they're all bad. Some supplements are better than others. If you're a subscriber to this channel, you'll know I've discussed many of these supplements in past videos, and I'll continue to do so if I can. So again, you want to, all these topics I just mentioned, they're covered each month in my Applied Metabolics. It's at www.appliedmetabolics.com. It's extremely inexpensive, 33 cents a day. It's 30 to 45 pages every month. Again, no advertisements, pure information. And not only has current evidence-based science information, but it also has something that can't be matched by any other digital publication, which is my over 6 decades of study and experience. To my knowledge, no other digital publication has that much experience behind it, and it's all incorporated in Applied Metabolics. When you subscribe to Applied Metabolics, send me an email, and I'll send you an invitation to join my private Applied Metabolics Facebook page, where each day I post new information on nutrition, exercise science, and general medicine and health. I have an email portal on my Applied Metabolics webpage where current subscribers only can send me short questions about anything they might have read in Applied Metabolics, or anything that's that they want to have a question about related to nutrition and exercise. I will answer them in appreciation for their subscription. You can look at it as kind of a bonus for subscribing to Applied Metabolics, which obviously means that I only answer questions submitted to me by current subscribers. Also, I would appreciate if you subscribe to this YouTube channel. This channel is completely free. I post new videos every Tuesday, if you think it's of any value, please tell others about it, and subscribe yourself. You'll only get the truth from me. I never lie. I've been a seeker of truth all my life, and I impart that to others. I'm not going to mislead you. I'm not going to lie you. I'm not going to bullshit you. So again, subscribe to Applied Metabolics, www.appliedmetabolics.com, and subscribe to this YouTube channel. If you want to have the best friend you'll ever have, go to your local shelter and adopt a dog, which I still haven't done. I'm going to do it very soon. I will. Take care. Thank you for listening.